Yes, these men and their hypnotized followers call this a new order. It is not new, and it is not order.
Dan Bedandi, Infowars.com here in Providence, Rhode Island at the Rhode Island Department of Health. And in about an hour from now, they're going to have an open public meeting where the public gets a question and ask the experts on a new mandated law that 7th graders have to have a HPV vaccine prior to entering school this year. Now, we have two senators here in Rhode Island, Josh Miller and Gail Golden, trying to push through a Senate bill 0381 relating to education immunizations that annuls religious exemption. So we're going to try to run into Josh Miller or Gail Golden, and we're also going to ask the public their thoughts on this new mandated law.
I'm Dr. Nicole Alexander Scott, the Director of the Rhode Island Department of Health. We are going to be engaging in a dialogue tonight about HPV and HPV vaccines.
Over a dozen concerned parents showed up to voice out against the HPV vaccine mandate. They had a lot to say in contrary to what the Rhode Island Department of Health was reporting.
You mentioned earlier that there are no reported cases of major adverse events from this immunization. My two older sons received it without event. You also mentioned that any report gets thoroughly investigated. Is that correct?
Yes.
How does it get investigated?
The vaccine adverse events reporting system. They get
if an adverse event were to be reported through that system, that would get investigated.
Yeah.
Okay. My stepson, 10 months ago, had the HPV immunization, and a week later went blind in his left eye. We became concerned, took him to the emergency room where he had a CAT scan of his brain that was normal. His vision still has not fully returned. We reported it through that adverse event. We're waiting for the investigation to happen. I would describe that as a relatively major event. So I'm offended that I was insulted by them, and I'm disturbed that the reporting doesn't lead to an instant investigation, and that you can present it tonight as having zero adverse effects. Loss of vision counts. So I also, one more thing, and then I'll sit down and shut up. False comfort concerns me. This immunization does not, doctor, prevent cancer. Can we agree that the word prevention in your Department of Health's marketing is an overstatement?
Commissioner, people are gathering on both sides of this. And I guess that's where my question comes in, is why, if the CDC is not making this a required vaccine, which to me says they don't have enough evidence to make it a required vaccine, why is Rhode Island taking the stance of using all of the recommended and making them required? And I would just love to hear the rationale behind that from your perspective.
CDC only recommends. They do not require vaccines to use the exemption if they don't know about it.
This and that, and it sounds very reassuring, but it sounds like, to me, bland reassurance. The fact, I think it takes a lot of courage to come up here and tell people that this vaccine is safe and effective when the research isn't there to support it. And I think it's very nice to say you can get an exemption when many of these poor people may not be aware of it, and they may not really know the safety issues and the efficacy issues, and they're going to trust the Department of Health and their mandate. So you're kind of speaking out of both sides of your mouth here. Is it safe? Is it effective? And if so, why are you not presenting us with the data? And the reason is that the data doesn't exist.
The religious exemption has been in Rhode Island for a while, but I've heard from a lot of parents where a lot of the school nurses bully parents when they want to get a religious exemption. I know one parent who was told, okay, I need a letter from your pastor, I need this notarized, I need this, or by your,
They single the children out too.
Yes,
yeah, so I think that there's a lot of miscommunication between the Department of Health and the school that's requiring this, and it's very confusing for parents, and it makes our trust drop.
If you have a child who's at school who has a religious exemption and their eyes happen to be red, they're sent home because they are unvaccinated. They may be spreading something much more serious than not getting enough sleep the night before. There's lots of bullying. There's lots of parents out there who, when you say that exemptions are available, readily available, whoever wants them, that is completely untrue. Even as parents of children who are clearly and undeniably vaccine injured, people have to quit their jobs to take care of their children to prove that they qualify for one of these exemptions, and it's not an easy process.
And to add to what you're saying, you want to take a religious exemption in a public building where, other than the Pledge of Allegiance, if I use the word God, I'm shown the door. So how are you going to be, how is a 7-year-old, 11-year-old boldly enough to say, I'm religious?
A religious exemption? Why can't it just be a choice exemption? Why do I have to say it's based on religion, other than it's based on me informing myself, and I simply disagree with the information that you put out?
I spoke to Senator Miller earlier this week. We are the ones at the Department of Health who make the ultimate determination about whether or not religious exemption should or shouldn't be there. And with this process, and even in our own decision making, we had chosen to hold off on that because we knew that parents wanted to have that available.
I read a quote by Senator Josh Miller actually today in a newspaper disparaging parents for having used religious exemptions, as he put it, inappropriately. However, I feel like we're being ordered into it, and I think that there needs to be another option. I am not religious. Why should I have to use a religious exemption when I don't want to give something to my child that I have researched thoroughly and do not feel comfortable giving to her?
Even though Senators Miller and Golden were nowhere to be found, I had a chance to speak with some of the parents who were very upset about the Department of Health undermining their parental rights.
They say that the vaccine is effective, but the studies actually show is that there is a 0.58% reduction in cervical preneoplastic changes. There's no evidence that it has prevented even one case of cervical cancer. Yet the Department of Health is putting forth to the community that this vaccine is safe and it does prevent cervical cancer. There's no research evidence to support that. And when you ask them about this, they just say the research says. They never produce a single paper.
And as a parent, what are your thoughts right now that knowing this is mandatory? And isn't that a contradiction? They said it's a choice, but it's mandatory. I mean, what are your thoughts?
I'm extremely concerned about it because it shouldn't be mandatory. It feels like a gross overstep of governmental role for me.
My thoughts as a parent is that I believe we're seeing one side of the picture or one side of the equation. We're being told it's a mandate. We're being told that it prevents cancer, which there's no clinical research to show that it does. And then we're not being told that we have a choice and that we have the capability of seeking a religious exemption. But how do you suggest that we have a choice in this matter to vaccinate our children or not with something that has, $30 million has been rewarded in lawsuits across the country for people who are suffering damages from this highly dangerous array of ingredients that are being pumped into our children's veins.
Do you feel that the HPV vaccine is safe enough for them to mandate it?
I don't think they even have the right to mandate any vaccine, even if there were no injuries from this vaccine. It's none of their business to be mandating this for a disease that can't be spread within school. I mean, I guess I understand their intentions are okay, but I think that they're out of line with this.
Now, as a parent, doesn't it undermine your ability to choose and pick what's best for your children?
Right, and that's why I'm here, because I think that for this vaccine, since it can't be transmitted within the school, I think it's up to me and my pediatrician to decide if we're going to administer it or not.
And I just want to get your quick comment on this. Now, according to naturalnews.com, that one of the lead Gardasil developers, he clearly stated, to clear his conscience, he admitted that the vaccines, the HPV, it's useless and deadly. What are your thoughts on that?
I think that the evidence isn't in. I don't know if it is going to be useless. It may have some positive effect, but we don't know how much of a positive effect, and we haven't established a risk-benefit ratio. In every medical intervention, you have to look at what the risks are and what the benefits are. They haven't done those studies.
And as usual, officials, the so-called experts, had no direct answer but used circular reasoning for the public's questions. But however, we had religious exemption attacked in California, as 2 senators here in Rhode Island already tried to do. So folks, we're in trouble unless the parents in Rhode Island stand up and say no to mandatory vaccines. And how direct is the Rhode Island Department of Health right here when they got the former director chasing a pilgrim with a syringe? Folks, that's the agenda right there, folks. That's exactly what they're trying to do, force inoculate the entire population for population control. Dan Bedandi, Infowars.com.
In the past decade, we have witnessed unparalleled scientific discoveries in the area of health. But no one has put together a formula that focuses directly on brain health, nerve growth factors, and optimizing your cellular energy at the same time. DNA Force is one of the most expensive formulas to produce. Some of the ingredients in DNA Force are $12,000 a kilogram. We are using the coveted, patented, only American source of PQQ, CoQ10, and more. You want the best that's out there at the lowest price anywhere? Well, we're bringing you a total win-win. The ultimate value, cutting-edge, trailblazing game changer that also supports the InfoWar. We have produced a limited run of DNA Force, and it will take up to 12 weeks to produce more once we sell out. Secure your DNA Force today at InfoWarsLife.com or call toll-free 888-253-3139. DNA Force from InfoWars Life.